Radiology at Liaquat National Hospital, and part of the interventional radiology at Liaquat National Hospital will join. Dr. Priyanka, can you please start your presentation?
So can you see my screen?
Yes, I can see your screen.
Assalamu alaikum. Thank you for the introduction, sir, and thanks for the opportunity to discuss this topic in detail again. We'll go through a quick review that we discussed in the previous session. Posterior fossa veins are divided into 4 major groups. That is superficial veins, deep veins, brainstem veins, and bridging veins. Superficial veins supplying the tentorial surface, suboccipital surface, and petrosal surface of the cerebellum. Deep veins supplying the cerebellum mesencephalic fissures, 4th ventricle walls overall, cerebellum mesencephalic, cerebellum medullary, and cerebellum pontine fissures. We discussed these 2 group of veins in details in the previous sessions. In this session, we'll discuss about the brainstem veins and the bridging veins, which are the major sinuses that drain these group of veins. So just to have a quick review of the previous session, this is the tentorial surface. Here we can see that superior hemispheric and superior vermian veins draining anteriorly into the vein of Galen and posteriorly into the tocula. This is the suboccipital surface. Here we can see that inferior hemispheric, this surface is drained by the inferior hemispheric vein and the inferior vermian vein. Inferior hemispheric veins course superiorly as they ascend and cross the posterior margin of the tentorial surface to anastomose with the superior hemispheric veins into the tentorial sinuses. This is the anterior surface of the petrosal surface, anterior surface of the brainstem and petrosal surface. This surface is majorly drained by the anterior hemispheric veins, which drains eventually into the superior petrosal vein. This is a tentorial surface in which we can observe the tentorial sinuses. Tentorial sinuses, this left side of the tentorium has been removed in this dissection. Here we can see that the superior hemispheric vein and the inferior hemispheric vein drain into the tentorial sinuses. These sinuses receive veins from the cerebral and cerebellar hemispheres. This is a superior lateral view of the cerebellum. Here we can see straight sinuses draining in the tocula, transverse sinuses, and superior petrosal sinus. For a quick review, the tentorial surface, the anterior area of the tentorial surface, these vessels course anteriorly to drain into the cerebellum mesencephalic fissure and into the vein of cerebellum mesencephalic fissure that eventually drain into the vein of Galen. The posterior veins, the posterior supply of veins drain into the tocula, and the lateral margin is drained into the superior petrosal sinus. This is a lateral view of the cerebral hemisphere and the cerebellum. Here we can see cerebral lateral and inferior cerebral veins course into the transverse sinus. And mastectomy has been done to expose the course of transverse sinus to the sigmoid sinus, and jugular bulb has also been exposed. In this dissection, left cerebral hemisphere has been elevated to expose the group of veins, cerebral veins draining into the tentorial sinus. We can see that 2 anterior temporal veins coursing from lateral and inferiorly drain into the transverse sinus. However, one of the temporal veins posteriorly drains through the tentorial sinus into the transverse sinus. And this dissection, right side of the temporal lobe has been elevated to show the to further evaluate the complex course of veins that drain into the transverse sinus. These temporal veins are draining directly into the transverse sinus, and we can also observe these anterior and posterior group of temporal veins and the vein of Lebe from the sylvian vein to the transverse sinus. In this dissection, the right side of the tentorium has been removed to expose the tentorial sinus, which receives its drainage from the cerebral hemisphere and the cerebellar hemisphere as well. In this dissection, the posterior lip of the cerebellar mesencephalic fissure has been removed. This is a tentorial dissection. Posterior lip has been removed to expose the deep cerebral veins, in which we can see that the vein of superior cerebellar peduncle from coursing over the superior peduncle drain into the vein of cerebellar mesencephalic fissure, which eventually drains into the vein of Galen. So we'll start from the veins of brainstem in this session. Veins of the brainstem has been grouped and named according to their course, if they course longitudinally or transversely. The longitudinally coursing veins are the median anterior pontomesencephalic vein, which continue downwards as the median anterior medullary vein, which we discussed previously as well. These veins are majorly named as the area they course from and according to their pathway. So this longitudinal vein is termed as the median anterior pontomesencephalic vein and the median anterior medullary vein, which courses over the medulla. There is also lateral anterior pontomesencephalic vein on the anterolateral surface of the mesencephalon and the pons, and lateral anterior medullary vein, which is also known as the preolivary vein, as it travels in front of the olivary nucleus. And there's lateral mesencephalic vein and the lateral medullary vein and the retro-olivary veins. Those that course transversely involve pontomesencephalic vein, pontomedullary sulci vein, transverse pontine veins, transverse medullary veins, and the peduncular and the posterior communicating veins. We'll discuss these veins in the further slides in detail. To start from the median anterior pontomesencephalic vein. The median anterior pontomesencephalic vein course at the midline over the pons and the mesencephalon. This vein is divided into two segments, the mesencephalic segment and the pontine segment. The mesencephalic segment courses in the interpeduncular fossa, as we can see here in this picture. It has two asymmetrical veins which course near the third nerve. It has a rostral confluence with the peduncular veins and posterior communicating with the medial border of the peduncular vein and the lateral border of the posterior communicating vein, as we can see here. It can also be communicated, it has a tributary from small veins exiting the posterior perforated substance as well. It courses inferiorly and few millimeters below the pontomesencephalic sulcus. It forms the pontine segment of the median anterior pontomesencephalic vein. The pontine segment courses in the basilar sulcus. It connects caudally with the median anterior medullary vein and the vein of pontomedullary sulcus. It has three segments: superior, middle, and inferior parts. Usually, one of the parts may be missing, and therefore the other parts in anastomose with the corresponding transverse veins, which we will see in subsequent sessions, subsequent slides as well. The median anterior pontomesencephalic vein continues downward as the median anterior medullary vein, as we can see here. It courses between the medullary pyramids. Superiorly, it is continuous with the median anterior pontomesencephalic vein, or if the inferior segment is absent, it may continue from the lateral anterior pontomesencephalic vein and also joins the vein of the pontomedullary sulcus. Inferiorly, it continues as the anterior spinal vein. It may have bridging veins, which course to the sinuses around the jugular foramen. Lateral anterior pontomesencephalic vein. They are present at, as we discussed, they are present at the anterior-lateral aspect of the brainstem. As you can see in this schematic diagram, at the mesencephalic level, they form a junction. At the mesencephalic level, they form a junction with the basal and peduncular veins, as it has been seen in this diagram, and the vein of the pontomesencephalic sulcus. At the pontine level, it joins the transverse pontine. It is joined by the transverse pontine veins. Caudally, it joins the vein of the pontomedullary sulcus near the abducens nerve. It may have bridging veins to the inferior petrosal sinus. Below the lateral anterior pontomesencephalic vein, we can observe that there is lateral anterior medullary vein. It is present in the anterior lateral sulcus between the pyramids and the olive. It is partly hidden by the roots of the hypoglossal nerve. Superiorly, it is joined superiorly by the vein of the pontomedullary sulcus and inferiorly by lateral medullary vein or the transverse medullary vein. Lateral mesencephalic vein courses in the lateral mesencephalic sulcus. It drains the posterior lateral aspect of the midbrain, or it may also have drainage from the caudalogeminal plate. It drains into the basal vein near the medial geniculate body. Inferiorly, it it may join the pontotrigeminal vein and the vein of the pontomesencephalic sulcus. The lateral medullary and the retro-olivary veins. These are present at the lateral border of the olive and the foramen of Lashka. These are divided into two segments. These veins are divided into two segments. A large dorsal vein, that is the lateral medullary vein, and a smaller retro-olivary vein. The large dorsal vein is course along the rootlets of the accessory vagus and the glossopharyngeal nerve. Ventrally, it may receive branch from the retro-olivary vein, and dorsally it may receive a branch from the inferior cerebellar vein of the inferior cerebellar peduncle. It joins the vein of the pontomedullary sulcus and courses into the and drains into the vein of the middle cerebellar peduncle. The smaller vein, that is the retro-olivary vein, it is usually present at the rostral root hairs of the retro-olivary sulcus. It anastomoses caudally with the lateral medullary vein, and cranially, rostrally, it may anastomose with the lateral medullary vein, or it may drain directly into the pentomedullary sulcus, vein of the pentomedullary sulcus, and join the vein of the middle cerebellar peduncle. Peduncular vein arises in the interpeduncular fossa. It courses laterally. It courses laterally below the optic tract. Here would be the optic tract. It courses laterally below the optic tract towards the base to drain into the basal vein. It anastomoses medially with the lateral border of the posterior communicating vein and the superior border of the median anterior pontomesencephalic vein. It is to be noted that it is located on the superior medial surface of origin of the third nerve. The posterior communicating vein courses in the interpendicular cistern it courses through the interpedicular cistern rather than on the floor of the interpedicular cistern. As spread on the superior medial surface of the oculomotor nerves, it interconnects the medial ends of the peduncular veins, as we have seen in previous slides as well, and it also joins the median anterior pontomesencephalic veins. The vein of the pontomesencephalic sulcus passes below the oculomotor nerves, as we can see here, and anastomosis with the median and lateral pontomesencephalic veins. And it drains into the lateral mesencephalic and pontorageminal veins, anastomosis with the lateral end. The transverse pontine veins, it is a group of veins which interconnect the median anterior pontomesencephalic vein with the lateral surface of the pons. This is the anterior schematic diagram. This is the posterior view of the brainstem. Here we can see the transverse pontine veins coursing laterally and connecting with the superior petrosal sinus. Medially it connects with the median anterior pontomesencephalic vein. Laterally, it may course directly into the superior petrosal sinus, or it may connect with the pontorageminal vein of the cerebellopontine fissure, or vein of the middle cerebellar peduncle, and then drain into the superior petrosal sinus. The mid-pons has the most prominent transverse pontine veins. It may have bridging veins into the two inferior petrosal sinuses. Similarly, there we have vein of the pontomedullary sulcus. It connects with longitudinally oriented veins on the anterior aspect of the pons and the medulla. It joins the lateral medullary or the retro-olivary veins of the inferior cerebellar peduncle and drain into the vein of the middle cerebellar peduncle. The transverse medullary veins cross the anterior and lateral surface of the medulla at the level of the pyramids. It interconnects the median anterior medullary vein to the lateral medullary vein. This is a dissection of the anterior view of the brainstem. Here we can see that in the midline we have the median anterior pontomesencephalic vein. As we discussed earlier, the pontine segment has three segments. Here we can observe the superior segment and the inferior segment. However, the middle segment is missing. So the superior segment and the inferior segment drain into the transverse pontine veins. The median anterior pontomesencephalic vein continue downwards as the median anterior medullary vein, longitudinally. Transversely, we can observe the transverse pontine vein of the pontomesencephalic sulcus. And we can also observe that the vein of the cerebellopontine fissure draining into the superior petrosal vein. This is a superior view of the brainstem. Here, this is the basal vein. We can observe that the veins from the crural cistern and the ambient cistern drain into the basal vein, which eventually drains into the vein of the Galen. The basal vein on the left side has also the temporal horns have been exposed to show that the basal vein has supply from the lateral walls to the temporal horn as well, which drains the vein of the Galen. Internal occipital vein has been exposed to drain into the vein of the Galen. The groups that we discussed drain from the cortical surfaces of the cerebellum and the brainstem and the deep surfaces through the arachnoid layer to the dural sinuses. These sinuses have been divided into three major groups: a Galenic group that drains to the vein of the Galen, a Petrosal group that drains to the petrosal sinuses, and a Tentorial group that which drain on the sinuses converging on the tocula. In this schematic diagram, we can see it has been color coded. The veins in the green drain into the Galenic group, which we have discussed previously, that the superior part of the anterior part of the superior cerebral hemisphere drain into the Galenic group. The veins color coded in blue drain into the petrosal sinuses. The veins color coded as red or brown drain into the tentorial group. So we can see that the Galenic group has its tributaries from the tentorial surface, the cerebellomesencephalic fissure, and the superior half of the roof of the fourth ventricle. The Petrosal group has its tributaries from the petrosal surface, which is the anterior surface of the cerebellum, the cerebellomedullary and the pontine cerebellomedullary and cerebellopontine fissures, inferior half of the roof of the fourth ventricle and the lateral recesses, the anterior and lateral sides of the pons and medulla. However, the tentorial group has its major drainage from the suboccipital surface. The Galenic draining group, which is the vein of the Galen, is supplied by the superficial group. From superficial group, it is supplied by the superior Vermian vein, which we can observe here. The superior Vermian vein, we can see that superior Vermian vein has its branches from the vein of the mesencephalic fissure and deep. It has supply from the deep group from the vein of the cerebellomesencephalic fissure and paired veins of the superior cerebellar peduncle. From the brainstem, it has peduncular, posterior communicating and tectal veins, and the rostral portion of the medial and lateral anterior pontomesencephalic and the lateral mesencephalic veins. All these veins drain into the basal veins. All these veins drain into the basal vein. However, the tectal veins drain into the cerebellomesencephalic fissure, and which eventually drains into the vein of the Galen. This is the mid-sagittal view. Apologies, this is a tentorial surface. This is a dissection of the tentorial surfaces in which we can see that the interior cerebral vein and the vein from the anterior cerebral vein crossing above the pineal gland course into the vein of the Galen, and basal vein, and along with superior Vermian vein of the cerebellomesencephalic fissure, drain into the vein of the Galen. This is a tentorial surface in which both the tentorial surfaces have been shown. Here we can see that the internal cerebral veins, along with the pineal vein and the basal vein, drain into the vein of Galen. The next major draining sinus is the tentorial draining group. It receives its superficial veins from the inferior Vermian veins. The inferior Vermian veins from the suboccipital surface ascend superiorly behind the transverse sinus into the tentorial sinus, which is clear in this section in which the tentorium has been removed from both sides. We can see it at that a large inferior hemispheric vein and a small superior hemispheric vein is draining into the tentorial sinus. The tentorial draining group also receives its drainage from the posterior group of superior hemispheric and superior Vermian veins. It also has supply from the inferior cerebral veins, vein of Labe, and bridging veins from the tentorial edge, which we have seen in the previous slides. These groups enter the tentorial sinuses. Tentorial sinuses further may drain. It may drain medially directly into the mid portion of the straight sinus. It may drain posterior medially into the docula, as it is seen in this dissection that this tentorial sinus drain into the mid portion of the docula. It may drain course posteriorly and drain into the middle third of the lateral sinus, or posterolaterally, as we can see in this dissection, and can drain into the lateral third of the lateral sinus, or directly into the superior petrosal sinus. In this dissection of the tentorial surface, we can see that the tentorial sinus receiving its drainage from the inferior hemispheric vein and the superior vermian vein and the superior hemispheric vein is draining directly into the tocula. However, the tentorial sinus present here is draining into the lateral part of the transverse sinus. The petrosal draining groups has its drainage from superficial veins that supply the lateral part of the cerebral hemisphere and deep group from the cerebellopontine, cerebellomedullary, and the lateral part of the cerebellomesencephalic fissures. It is also supplied from the inferior part of the roof and lateral wall of the fourth ventricle and brainstem group. It has been divided into inferior petrosal veins, which drains into the inferior petrosal sinus, and superior petrosal veins, which drains into the superior petrosal sinus. The group of veins of superior petrosal sinus have been divided into lateral, intermediate, and medial group, depending on its relation to the or to the acoustic meatus. The veins that drain above the drains into the superior petrosal sinus above the acoustic meatus are termed as intermediate group. The veins that drain medially into the petrosal sinus are termed as medial group, and subsequently, the veins that drain laterally from the acoustic meatus into the superior petrosal sinus are termed as lateral superior petrosal sinus veins, petrosal veins. It has tributaries from the transverse pontine and pontotrigeminal veins, common stem of lateral group of superior hemispheric veins, as we discussed previously, and veins from the cerebellopontine fissure and the middle cerebellar peduncle. This is an interior view of the brainstem. Here we can see that the vein of the middle cerebellar peduncle ascending and forming a junction with the vein of the cerebellopontine fissure and the transverse pontine vein and ending draining into the superior petrosal vein. This is a retrosigmoid dissection in which we can see that pontotrigeminal vein, anterior hemispheric vein, and vein of the cerebellopontine fissure drain into the superior petrosal vein. It is important to observe that this complex of veins is encasing the trigeminal nerve and the superior cerebellar artery. So during the exposure of the trigeminal nerve, it is important not to injure superior cerebellar artery, while we can at times compromise these veins, which we'll discuss in further slides as well. This dissection is the anterior, this is the anterior wall of the posterior. This is the posterior wall of the anterior area of the posterior fossa. Here we can see we can observe that the inferior petrosal sinus can be observed within the dura. Inferior petrosal sinus and the sigmoid sinus both can be observed in the dura. Here the dura has been removed. Here we can see that the inferior petrosal sinus drained from the basilar sinus to the sigmoid to the jugular bulb of the sigmoid sinus. In this dissection of the retrosigmoid craniotomy, we can see that the inferior petrosal vein is coursing from the medulla to the sigmoid sinus between the 9th and 10th cranial nerve. However, in this dissection, we can see that the inferior petrosal vein is traveling behind the 9th and 10th nerve. Similar to this dissection, where we can also see that the inferior petrosal vein is traveling behind the 9th and 10th cranial nerve. Therefore, it is important to look for these veins while exposing these nerves for the respective neuralgias. So just to discuss about the surgical correlation, due to diffuse anastomosis between these post-fossa veins, the adverse effects are an infrequent event, even if an intraoperative occlusion happens. However, severe sequelae can be seen if there's occlusion of the bridging veins, which are the major draining sinuses from the cortical surfaces. Mostly bridging veins are sacrificed during the CP angle operations near trigeminal nerve compared to the 7-8 nerve and the inferior group. As we discussed in the previous slides, that there's a complex of veins forming. You can see here. There's a complex of veins forming around the trigeminal nerve in which there's prone to injury of the sinuses and the artery as well. Usually we have the superior petrosal vein here, which is located just lateral to the trigeminal nerve. And however, adverse sequelae is rare. However, the author have seen 2 patients with transient cerebellar disturbance due to the cerebellar infarct due to occlusion of these veins. For trigeminal neuralgia, author has seen that out of 411 cases, 153 cases had veins compressing the nerve. Similarly, compression of the facial and glossopharyngeal nerves can also be caused by veins, causing hemifacial spasm and glossopharyngeal neuralgia. In the infratentorial supracerebellar approach, bridging veins from the tentorial and the suboccipital surface are an important obstacle that need to be careful about. The surgeon needs to be careful about. However, they can be sacrificed without an adverse effect. In one of the cases, cerebellar swelling has been observed following the transection of one of the bridging veins. In the fourth ventricular approach, veins around the tonsils, lower vermis, and inferior part of the roof, including the venocerebellar medullary fissure, have been occluded repeatedly without any severe sequelae. Thank you.
Thank you, Dr. Priyanka, for this detailed presentation. It was a difficult topic and you managed to explain it. I would now like to request Dr. Ali for his expert opinions, and if he has some slides to share, he's welcome. Dr. Ali, can you hear me?
Yes, Dr. Saad, I can hear you. You can hear me now?
Yes, you have an echo. If you're on 2 devices, can you mute one?
No, I'm on a single device, on a laptop computer.
So, Dr. Ali, if you have, can you please give your expert opinion on if
I have collected 2 images for which I was able to. Let me share my screen.
Dr. Priyanka, can you mute yourself and please stop sharing?
Now you can see my screen.
Yes, Dr. Ali, we can see your screen.
Assalamu alaikum. I'm Dr. Ali from LNH. I'm doing basically an IR in LNH. Talking about the venous sinuses of the brain. This is the gross picture which you see when you are doing an angiogram of the brain. In the venous phase, grossly speaking, everyone knows, all surgeons. So this is the superior serratus sinus, and these are the transverse sinuses. When it dips down, it makes the sigmoid sinus. There's a jugular bulb, and it's continuing inferiorly as a interjugular vein.
Dr. Ali, can you use can you use a pointer and go on full screen? Can you go on full screen?
I have done my full screen.
I mean, it's not visible here on Zoom, I guess.
Okay.
And there's some sound in the background as well. That's kind of disturbing.
No, can you hear now? Can you see the full screen now?
Not yet.
Yeah,
so you can just zoom. You can just zoom the. You can just increase the magnification. Maybe it's not going on full screen here on Zoom.
No, fine.
Yeah, it's a little better. Yes, a little better. So, there's some noise in the background. Maybe it's you. I think you're using a headphone or something. Or
yes, I'm using the headphone.
I think yeah.
Oh, it's fine. The voice is fine now.
The noise is still there. I mean, I don't know what it is, but pretty loud.
Actually, let me change my place.
I don't know if it's the birds or I mean the voice is pretty much. Yeah.
Yes. I am changing my place. No, it's fine now.
Well, you can continue. I mean, I don't know what the voice is, but You can start, Dr. Ali.
This is basically a lateral view of a venogram. When you are doing an angiogram of the brain, you can see there is a superior parietal sinus and the inferior parietal sinus, which is small in size. This superior parietal sinus and the transverse sinuses have a confluence where they meet up for the confluence of the sinus or cochlear. Inferiorly, the transverse sinus gets stripped down and is continued with the sigmoid sinus, and which is continued inferiorly in the interjugular vein. Over here, the inferior parietal sinus is inferior parietal sinus meets up with the vein of Galen and makes the straight sinus. This vein of Galen is anteriorly drained by the multiple mesencephalic veins and the internal cerebral veins. So this was the gross view or gross picture of the venous anatomy. In order to have a good venous anatomy or venous picture of the brain, you need to have a bilateral injection of the vertebral arteries. The author recommend if you're doing an angiogram and you are doing for a venous phase, then doing a single vertebral artery injection will not be helpful. You will not get a good image. These all images which I am showing have been done from bilateral vertebral artery injection to have a good venous phase. This is basically a Townes view or the deep craniocaudal view of the venous phase of the posterior fossa. The problem with the Townes view is that all the veins comes below the transverse sinus. So you cannot separate between the superior and the inferior veins of the cerebellum. These are the transverse sinuses. Two transverse sinuses on both sides, right and the left one. And the most important vein to recognize on this is the largest is the posterior inferior cerebellar vein. This one and this one is the posterior. The red arrow is the posterior inferior cerebellar veins. Another vein is the inferior vermian vein, which sometimes drain into the transverse sinuses. It has multiple variations as well. We will show you in the next slide. While these two pink are the lateral mesencephalic veins, which are connected by interpeduncular vein. These interpeduncular vein, which is connecting the right and the left lateral pontomesencephalic veins. Okay. This white one is the superior petrosal sinus, which drains into the sigmoid sinus, superior petrosal sinus, which is anteriorly communicated by the communicated to the cavernous sinus. So the posterior part of the cerebellum basically drains in the transverse sinus, while the anterior part of the cerebellum drains into through the anterior cerebral veins, drains into the superior inferior petrosal sinus. When you get a lateral image of this venogram, on the lateral image of the same projection, you can see a better visualization of the posterior inferior cerebral veins. These are the two vermian veins and the posterior inferior cerebellar veins, which are draining inferior part of the cerebellum into the transverse sinuses. And these are the anterior cerebral veins. The green line are the anterior. The green arrow is the anterior cerebral vein, which is basically draining anteriorly into the superior petrosal sinus. And this superior petrosal sinus also gets drainage from the cavernous sinus and posteriorly drain into the sigmoid sinus. So the anterior part of the brain drain into the petrosal sinus. These are the vermian veins. You have got some variations. These are the inferior vermian veins, both draining into the right transverse sinus. You can get a separate drainage, some the right side to the right and the left. Sometimes both of them has a common drainage into the transverse sinus. And this is the posterior inferior cerebral vein, the superior petrosal sinus, the right arrow. Talking about the anterior surface of the brain, the anterior venous drainage. This is the picture for the anterior venous drainage. This is the transverse and the sigmoid sinus. These are the superior surface of the cerebellum. This is the inferior one. Superior tentorial surface and the inferior tentorial surface. This is the straight sinus, and this is the vein of Galen. This blue arrow is basically the superior Vermian vein. This one is the superior Vermian vein, which is draining into the vein of Galen, and this yellow one is the inferior Vermian vein. Or these red one are the anterior cerebral vein, which are draining into the superior petrosal sinus. The pontomesencephalic veins are actually small in caliber. This one is the lateral pontomesencephalic vein, which drains into the basal vein. Basal vein ultimately drains into the vein of Galen, basal vena vazantal. So this is the lateral pontomesencephalic vein, which is draining into the basal vein, and this yellow marker is the connection between the two lateral pontomesencephalic for the interpeduncular vein. And this one anteriorly is the anterior pontomesencephalic vein, which will inferiorly continue as an anterior spinal vein. On the lateral view, this is the same thing. The black arrow is the basal vein of Rosenthal, basal vein. These marker are the anterior cerebral veins, which are draining anterior into superior petrosal sinus. And these one are the lateral mesencephalic veins, which are connected by the interpeduncular vein on both sides. And if you go up, these lateral pontomesencephalic veins drain into the basal vein, and the basal vein ultimately drains into the vein of Galen. This is another view of a lateral venogram. You can see there the superior and inferior Vermian veins, and this light blue marker is the superior this is the superior cerebellar vein. This is the superior cerebellar vein, which drains into the vein of Galen. This one superior Vermian veins drain into the superior cerebellar vein, and the superior cerebellar vein ultimately drains into the vein of Galen. This is the inferior Vermian vein and the superior Vermian vein. And talking about the petrosal sinuses, this is the superior petrosal sinus. It drains into the sigmoid sinus, and it is anteriorly the anterior petrosal sinus drains into the cavernous sinus. On the lateral view, you can appreciate the inferior, the Vermian vein inferior, and the red one are the anterior cerebral veins, which drains anteriorly into the superior petrosal sinus, and this one is the lateral mesencephalic vein, and this is the anterior pontomesencephalic vein, which is continued inferiorly as an spinal vein. This yellow arrow is the bilateral connection, interpeduncular vein connecting the bilateral lateral mesencephalic vein, and superiorly the lateral pontomesencephalic vein drains into the basal vein, and the basal vein drains into the vein of Galen. So these were the images I was able to collect. Basically, when we do an angiogram, we usually do an arterial angiogram. So we do a single vertebral artery injection. So we do not get these sort of images. These I have taken from the internet. So these images, to produce these sort of images, you need to do bilateral vertebral artery simultaneous injection to have a good flow of contrast into the venous space. Thank you so much.
Thank you, Dr. Ali, for these images and the description. It was a difficult topic and was covered in 2 sessions. A lot of names. If the participants have any question, they can use the chat box. If not, we would like to end the session. I thank you, Dr. Ali, for joining us.
Welcome, sorry for the distance.
Giving us time. We will like to have you in the future as well. If there's no question, I think we should conclude the session. Next week we'll be doing cerebellar anatomy. We'll see you all next week. Thank you.